This is Lene Rule, and today I'm here with Laura, the 2017 TravelNurseSource Scholarship winner. Laura, why don't you tell me a little bit about yourself, like what your major is and how you picked it?
Okay, so this is actually my second degree. My first degree was in biology, and I kind of got out of school and I was kind of being told in like different ways by family and by friends, and everyone's like, "What are you going to do? You have this degree in biology." I didn't know if I wanted to be a doctor, a PA, a dentist. I just was kind of really confused, and so I ended up starting to have like some health issues, and I was surrounded by nurses all the time. And they were just really, really, really an important group of people in my healthcare experience, always there for me, always answering questions thoroughly, checking on me. And I just realized that I wanted to give that type of care to somebody and be that person that not only advocates for a patient, but also who, just cares about them and is just there for them. Maybe they don't have family, or maybe they're lonely or something, and you can just kind of help that person through a really difficult time in their life, because nobody likes to have health problems. So I decided that I was going to apply to a clinical nurse leader program at the University of Maryland. And it's a 2-year program for people who already have a degree in something else. So it's really amazing because there's people in my cohort who are from all different backgrounds. And so I really like that about the program. And I just started on Tuesday. So I'm already overwhelmed. But yeah, it's a CNL program, clinical nurse leader program. So it's a master's program, and it's an entry level nursing program. So it's really great, and it kind of prepares you, I guess, to do further critical thinking than you would necessarily like in just a BSN program or a community college nursing program. So it has that added element of critical thinking and planning and implementing, because clinical nurse leaders are people who go around the hospital and they kind of look at, maybe an entire unit or an entire floor of a hospital, and they're kind of looking for cracks in what that area is implementing currently. So you're a crack filler, I guess, essentially. Like, you kind of go around, you say, oh, this isn't working, so we need to do this evidence-based practice to improve our patient outcomes, our patient safety, and that type of thing. So I like that added element of the program, and that's what really intrigued me to start that program.
Yeah, that's really exciting because it sounds like you'll have a better opportunity to shape what's really going on in hospitals and, just the type of care that patients are being provided.
Definitely. And it's a little bit more, I guess you have a little more autonomy too. And a lot of times, clinical nurse leaders, they like sit with hospital boards, and they're really, it's not just like at the, micro level, but it's also like, I guess at like a higher level, macro level too, because you'll talk to like a hospital administrator, and you sit down like ever so often and kind of go over all of the things that are happening in the hospital. And there may be, a few different CNLs that see, a resounding theme in that hospital. And there's also like boards and stuff that they go to that are for like East Coast or West Coast, things like that, where people share, their research about what's been going on, and what things they can improve. So I do like that part of it. It's definitely very an interesting experience that you maybe wouldn't get as a BSN. I don't know. I just, from what I've heard, it's, an added bonus, I guess.
Yeah, that's awesome. And is there like a floor or a specialty that you feel like more drawn to once you get out into the field?
Yeah, so I think that I really want to work in ICU or in trauma. I definitely want to do something where it's on your feet and you have to think. I consider myself a lifelong learner. I really like learning. I really like kind of being in the middle of things, and I'm not afraid. I've never been a person who's afraid of taking a chance or afraid of being wrong or afraid of questioning something. And so I think that that environment, will give me the opportunity to, I guess, feed that part of my personality that kind of needs more going on. I know that nowadays in nursing, I think wherever you are, you have a lot going on because there's a shortage in nursing.
Right.
And even if you're like on a med surge floor, you have sometimes you're overwhelmed with patients, but that's the kind of thing I guess as a clinical nurse leader you look at too, because if somebody is on this floor and they have 7 or 8 patients, how can you provide quality care with no errors? So, um, but I definitely see myself being in something intense like ICU, trauma, and the school that I go to, University of Maryland, they have the Trauma One Center across the street where it's literally across the street from my school. And, they have people flown in from all over to the University of Maryland System Hospital. And there's a lot going on. So they have all different types of unit, traumatic brain injury, just, I mean, any type of traumatic injury you can think of, they have a unit for it there. So I'm definitely excited to get some clinical experiences over there during my time in school and hopefully my foot in the door because I think that's what I would be best at.
Yeah, that's extremely convenient for you. Is there anything about going into nursing that makes you nervous? I mean, you're talking about trauma, ICU, and really influencing the decisions that happen in those units. So, is there something that you find intimidating about that?
Yeah, so I'll start. That's kind of a two-part answer because right now I'm already really nervous just because I've been working in dentistry for the past 13 years in the same office, the same people, and I'm an orthodontic assistant now, and
Okay.
so that's a very hands-on career as well. Um, Basically, anything the doctor does, you can do, and you do. So I'm coming from this place of not knowing it all because I'm not a dentist, but I know a great deal. And my boss, calls me over. Hey, look at this patient. Do you think I should move this tooth this way? What do you think is the best way? He definitely values my opinion. And I definitely, if he's really busy, I can look at the charts and I can tell the other girls what to do. And I am like, the manager, I guess, there for the other assistants. So leaving that and going to something that is very different. Yes, it's still in healthcare, but it's not dentistry, it's not braces.
Right.
That in itself is like very scary. And already this week, I'm like starting from the bottom again. Like you have to work your way up to have that knowledge base where you can provide really good care to somebody. And I guess that brings me to my other part. It's just like, um, it is scary, especially working in the environment that I want to be in because you have somebody's life in your hands. I mean, that's already been a resounding theme for my first week of school is that you as a nurse are the last line of defense for your patient. So it's not on the doctor if the medication is wrong. It's not on a pharmacist. It's on you. You're the person who administers that to them. So not only just medications, but other things. Like a lot of times you're the person who's inserting a catheter or you're the person who's carrying out directions from someone senior to you, whether it be a nurse practitioner or a doctor, a PA, whomever. You are the last line of defense. And that's a really I guess like precarious situation to be in. Like, I mean, it's kind of scary. So, I think yeah. I mean, I definitely plan on studying as hard as I can, and I plan on definitely learning as much as possible and not being afraid to ask questions. That in itself is scary too, because you don't want to look like you don't know what's going on. But it's an important thing to do. So it is nerve-wracking to start something new and to realize that once you're there, you are the person who's kind of like, no, you're not the doctor, but you're running things in your own right. So, and you're having to advocate for somebody and ask the right questions. Like if that person is in the ICU or in trauma, that person's going to be, a lot of times unconscious. So you are the person who is the line of communication for that family and that individual to people who are higher up. And that is a scary place to be in because you have to look at so many different factors. What is that person's culture? What is you know, who are they? Where do they come from? What's their age? What are their families' impressions about the situation? So it's a difficult course to navigate for sure, when you are going to be dealing in those types of critical care situations. But yeah.
And how do you think your experience in receiving care will help you as you pursue this career in nursing? Because you definitely have had plenty of experience, from the patient standpoint.
Yeah, so I think that for sure it gives you a different perspective because, and I want to answer this question carefully because I think that when you're a nurse in general, you have your set of things that you have to accomplish, and sometimes it's a lot, like the tasks that you're given and the things that you have to keep track of for multiple patients. It can be a lot. So sometimes we forget that, this isn't like a floating entity. This is like a human being, and having that level of compassion is sometimes pushed by the wayside. Even in my experience, it has been. And I don't think it's necessarily because the nurse, wasn't compassionate or loving or caring. It was because they were burdened and by a lot of things. And so I think that being a patient, I know, how that individual feels lying there. They're scared, they're worried, they don't know what to expect, all of those things. But then in addition to that, you have the nurse's standpoint where they're very, you know, having to think about everything critically and having to balance different patients and different situations and different needs. And so by putting those two perspectives together, I think that it will allow me to really advocate for my patients well, and it will allow me to just have that compassion because I think that if I ever got really frustrated or, you know, overburdened by something, I would be able to remember, think about when you were there, think about how you would feel. And we are human beings. So it is, it's sometimes your emotions get the best of you, but having that, um, that level of, I guess, compassion is important. And I feel like being a patient myself, I've seen things that, maybe I wouldn't do it like that. I've never been a nurse though, so it's hard to speak, but I definitely have seen things that, I've been like, I don't think I do it like that. So I think that from a patient standpoint, I mean, you definitely feel, you can feel like, not only your own emotions about what you're going through, but also I'm a sensitive to other people. So I know that sometimes I felt the emotions of my nurses too, albeit good or bad. Um, so I think just that heightened level of I've been a patient before and I have to give the same type of respect and the same type of compassion that I would have wanted and maybe not received or that I would want myself because I still could, at any moment go into issues with my condition.
Yeah, most definitely. And I think, once you get into the weeds, it'll be important to remember that and keep that in the forefront of your mind.
Mm-hmm.
So
Sure.
now that you're in school, you applied for this scholarship. I'm assuming you probably applied for a lot of scholarships,
I
but you
did.
you received $2,000 from us after writing a very well written and compelling essay about your experience. With your own personal health issues and then how you came to decide to be a nurse. How did you learn about our scholarship?
I actually was just kind of like researching. I can't even like pinpoint it to anything particular, but I know it was definitely like a web search. Um, I can't remember if it was like from Johnson and Johnson because I know that they have a lot of resources or like if I saw it pop up, but I definitely was doing a web search. It and yeah, it was a search for sure. And I don't think that I
Okay.
put in anything like particular. It's just kind of like nursing scholarships, and then I would go through and see like, do I meet this criteria? Oh no, or do I meet this criteria? Yeah, that kind of thing. So it was like I had like a really intense. I'm still doing it now, to be
Oh,
honest.
I'm
It's
sure.
like there's so many opportunities out there, and you never know. I mean, I'm so grateful for winning this scholarship, and I just would like to say that for anybody who is, going into any type of healthcare, nursing especially, obviously. But there are those scholarships out there, and if you look for them and if you try and apply and you don't, you may not get anything, but you may be on the other end and you may get a lot of money. So it's just about advocating for yourself and being proactive in, financing your education because the scholarships are out there, but you have to, look for them.
Yeah, absolutely. This is our first year doing this scholarship, so we did really try to get it everywhere that we possibly could, and we're excited to continue doing it in the future. So we're really grateful that it led us to you, and hopefully
I
we'll
am
be.
too. Thank you.
Yes, no, you're
I'm really,
welcome.
really, really grateful. Really grateful.
Well, we're excited to see what you accomplish in the coming years, so you'll definitely have to keep in touch with us.
I know, I know. I want to keep in touch with you guys, and we'll see. Like at the end of this, I may have no interest in ICU. I know that sounds
Right?
crazy, but it's like people have been telling me that. That's been like a theme. So you get a mentor when you first start at school, and my mentor is like, she's about to graduate, and she's like, oh, like I thought I wanted to do this, but now, like, no, I'm in this area, and it was something that she thought she would never do prior to starting school and having the experience. So I'm open to new things, but I'm pretty sure that's what I want to do. But we'll see. I'll have to let you guys know.
Yes, yes, we will. Is there anything else that you'd like to say about healthcare, nursing, and the scholarship in general?
Well, I just want to say that I'm really appreciative to you guys for, giving this scholarship. Nursing is such a great career, and I think that I mean, I don't know, but I have people, close to me who are nurses, friends, like friends slash family. um, and so there's just so many different facets to nursing and so many different areas that you can go into in nursing. I believe that it's a really, really wonderful career where you can get a lot back. And so I'm really grateful to you guys for recognizing that and for offering your scholarship. I know that it's going to help me a lot, and I'm just beyond like words grateful. It's going to really help me. So I'm really appreciative.
Well, you're
I really am.
welcome.
Thank you.
We are very happy to be able to do this for you, and we wish you the best of luck in all
Thank
of
you
your
so much.
future plans.
Thank you. I really appreciate that.
Thank you.
I will definitely let you guys know, and I'd love to keep in touch. I'm very grateful. Thank you so much.
No, you're welcome. We look forward to talking to you again soon, and thanks for taking time to share with us today.
Thank you.
This is Lene Rule, and I'm here today with Stephanie, the 2017 TravelNurseSource Scholarship winner. Stephanie, why don't you tell me a little bit about yourself, like what you're going to school for and all that good stuff?
Okay, sure. It's nice to meet you. My name is Stephanie Eby, and I'm going back to school for nursing. So I'm in the program at Rutgers University in Newark, and this is a program for people who already have a bachelor's degree. So I originally went to college for psychology and graduated in 2015, and now I'm really excited to be going back to school.
Yeah, that's awesome. And how much money did you get from our scholarship?
I was awarded $2,000 through the scholarship.
And what does that money mean to you as far as helping you pay for school?
It means a lot to me. I remember getting the phone call that I had won the scholarship, and it was in the afternoon. And actually that morning I had been looking at my tuition bill and just wondering how I was going to come up with the money to pay for it, because I did have some money saved up, but it wasn't enough to even cover a semester of school. So it really felt like just an answer to prayers when I got the phone call that I had received the scholarship, and I'm really grateful to have it. So thank you.
No, you're welcome. We're grateful to be able to help you out. I was on that phone call, and it was definitely exciting to hear, the relief in your voice when we called you. So that was really cool. How did you learn about the scholarship?
I learned about it through a website called Discover Nursing. So I had just done kind of a scholarship search for nursing scholarships, and that's how I saw it online.
Okay, very cool. Did you apply to a lot of scholarships then, I imagine?
Yeah, I'm still applying to scholarships. I have a spreadsheet telling me when the due dates are for various scholarships. But this one was actually the first one that I applied to, so it was definitely exciting to receive the award.
Yeah, that's awesome. So your semester will go January through May, and then how long in total will you have to go back to school to become a nurse?
It's going to be 16 months total.
All right. So then when is your expected graduation date?
They haven't released the exact date, but it's going to be May in 2019.
All right. And what are your plans after that?
So my long-term goals, initially I want to work as an RN for a few years, and then I do want to return to school again and become a nurse practitioner. And I'm excited about the field of nursing because there's so much broad potential to make a difference. So, I can see myself doing many things. But I think what I initially want to do is work in low-income communities or even rural communities where people don't necessarily have access to healthcare providers, just because I do see that there continues to be social inequality in our healthcare system, and I do want to be a part of, contributing to that change. So that's what I think I'm going to do initially when I'm done with school, and then later in my career, I do want to work in public policy, and I want to push toward healthcare reform and universal healthcare, just because I kind of talk about this in my essay, but I saw firsthand what happens when people don't have health insurance, and I just think, in the country that we live in, we have the wealth and we have the ability to treat every citizen, and I that's something that I want to work toward creating in America where that happens. So that's what I hope to do in the future.
Well, I hope you can accomplish that too. It's definitely a hot topic right now, and an ongoing subject of healthcare reform in the United States. And you wrote a very compelling essay when you applied for this scholarship. And I think we each have our own story on how the healthcare system has affected us in one way or another, but you just so happen to be compelled enough to do something about it. So that's very admirable. Does something make you, nervous about becoming a nurse, or is there anything you feel intimidated about?
Yeah, definitely. Just, knowing that you have the responsibility to take care of another person, you have the potential to really, really help that person's life, but you also have the potential to do a lot of harm. And so that's pretty scary when I think about it. I feel nervous about the weight of that responsibility. And I think, though, that it's probably something that most healthcare providers fear. So I try to put it into perspective and say, once I have gone through school and have some experience, I'll feel more confident and be ready to take on that responsibility.
Yeah, and I think every day is a learning experience in the medical field. Is there a specialty that you would like to focus on, or you're not sure about that yet?
I'm not sure. Initially I was interested in working in psychiatry just because my background is in psychology. And that's initially what kind of drew me toward nursing. But after seeing my fiance's illness and meeting so many different kinds of nurses, it just really broadened my eyes. And I don't know actually what I want to specialize in and what area I want to focus in, but I'm excited because there's so much to do and so many options by the whole career.
Yeah, and no matter what, I feel like your degree in psychology will definitely help you along. What are some things that you think, I know you're just in your first week of school, but that you think what you've learned in psychology will help you in nursing?
I think the two fields are actually very similar. They're both called the caring profession, and as a nurse, you have to be able to communicate, and you have to see someone for who they are and where they are in their life right now, and it's the same when you're working in a therapeutic setting. So I think having that experience is going to be helpful for me as a nurse, just to be understanding of who patients are and where they're coming from, and also just being with them at such difficult times of their lives and showing compassion and understanding. And I think it translates well to the field of nursing.
Yeah, absolutely. I think we take for granted, until you have a nurse or a doctor that you can't communicate with, what it means to have someone who's truly empathetic and, listening to your problems. So.
Yeah, for sure. And I definitely noticed a difference between nurses, even when I was meeting so many nurses, that there are people who make you feel like, they have time to hear what you have to say. And it makes a huge difference, just that emotional aspect of nursing.
Yeah, and so your fiance, you mentioned in your essay that he was sick, and so I'm sure, watching him go through that and interacting with the nurses gave you a lot of perspective. How does he feel about you going into the nursing field? And I'm assuming that he's doing well now.
Yes, he's doing well. He has been in remission since the spring of 2016, so he's doing well. Yeah, he's definitely excited for me. It's been a long journey, just because in order to apply to this program, I had to take prerequisite courses, and it's taken a while to get to this point where I am in school now. And he's just been a cheerleader the whole time. He was the one who encouraged me to apply to scholarships in the first place, and I don't think I would have if he hadn't pushed me toward that. And so, yeah, he's excited and supportive, and yeah.
That's really good. And I'm sure if we asked him, he would say you're his favorite nurse that he's ever had, right?
Yeah, I think he would still say that, yeah.
Well, very good. Is there anything else that you'd like to say as far as winning this scholarship and your nursing plans for the future?
Just that I'm really grateful for this, for winning this scholarship, not just for the money, but also for kind of like what it means to me personally, because, when I wrote the scholarship essay, I was really pouring my soul into it and describing this experience of my life. And so just to have people read that and then say that, okay, we believe in what your goals are and we want to support you, this feels really good, and I'm really grateful for that. So thank you.
No, you are welcome. And your essay and your words will stick with us for a long time, for all of us who read it. So we wish you the best of luck in your future endeavors, and hopefully we will be able to see you doing something really cool in the next few years.
Thank you so much. I appreciate it.
Thank you.